Yes, hello colleagues. Thank you for always following the YouTube channel. As for today, we are going to look at some other new topic that I'm going to share. And this one will help us to know more about infertility. As I have always told you, most of our topics shall find them on the YouTube channel, which is having Modrik'slectures. And we start, you'll always get to know more about the topics medics need to know, especially the certificate students and some other diploma students. So as for today, we are going to talk about infertility, and this is what you're going to see. The screen is shared. We shall go with together as I share, as also will be picking something. So as the names displayed, Message Mordecai is my name. That's the YouTube channel that you are seeing. And you can also connect via the Gmail, messagemordecai12@gmail.com for more information. If you need some clarification as you watch my videos. Let us go straight forward. This topic of infertility is from a course unit we call gynecology. And as the tutor's name who's going to give the information is Message Mordecai, who is a registered nurse and working as a clinical instructor. So what is infertility? As we are going to see the objectives in this real episode, all the viewers or the learners in this case should be able to define infertility, mention the types of infertility, explain the incidence of infertility, and lastly, mention the factors responsible for infertility. So we shall go straight forward to define infertility. Here we see fertility is defined as a failure of a couple within reproductive age to conceive after 1 year of regular unprotected sexual intercourse or coitus. The couple is in a reproductive age, but they fail to have a child, or they fail to again conceive if they once had a child within a period of 1 year of regular coitus. And with this, we shall start thinking that the couple is now having infertility. However, the interval may change, and the definition now changes from 1 year, in that the interval shortens as someone ages. For example, a woman who is aged 35 years is likely not even to reach 1 year. 6 months are enough for us to start diagnosing infertility. And also in men, 40 years are also enough for us to consider 6 months as the interval to say that this man is likely to be infertile. That is what infertility is. Next, as I told you, we shall look at the types of infertility. So we have two types of infertility: primary infertility and secondary infertility. So what are they? With the primary infertility, this couple has never conceived at all in their life. They have been with their normal situation. Now they get desire to conceive and they fail to have any single conception, despite regular and unprotected sex, even when they are in reproductive age. Such a couple, we shall say that they have gotten primary infertility. Then secondary fertility, here the couple has ever conceived, but they desire to conceive again, and now they fail. So with the secondary infertility, there is failure to have a subsequent conception. You have sex consistently, you have ever gotten pregnant, or you have ever conceived the first child, but you cannot conceive again. Then our third objective was to look at the incidence, the number of new cases in the general population. How is infertility there? And we say that 80% of couples achieve conception if they so desire within 1 year. of having regular intercourse. However, some will fail. We shall find that 10% for them, they can go as far as 2 years, and that's when they conceive. Another 10% can even remain infertile even at the end of 2 years. So good news is that the population has it that 80% can conceive within 1 year. What about the 10% which takes 2 years? What about even the 10% which takes more than 2 years? So you see that there is a desire for each one of us to know about infertility. This is a big problem in the marriage, and once someone marries and doesn't conceive, he gets psychological problem and social problem. So as we are going to understand that infertility is not something to neglect, we need to know something about it and hence try to do what is needful. Our last objective, we said you have to look at the factors responsible for fertility. Here we are saying, for someone to conceive, what should first be in place? 1, a healthy spermatozoa should be deposited high in the vagina. Meaning that we should have this healthy sperm be deposited high in the vagina, where that it has escaped the acidic media in the vagina. Then the next factor for fertility, we are saying that the motility or the motile spermatozoa should ascend through the cervix into the uterine cavity and the uterine tube. That this sperm which is able to move, as you are seeing from this diagram projected, should be able to move into the cervix, passes the uterine cavity, and reaches the uterine tubules. Why? Because fertilization is going to take place in the uterine tubules, especially on the ampulla. So if the sperm can't manage to reach the ampulla, it is very possible that this person may also be infertile. Then the next factor, we are saying that there should be ovulation. A mature ovum should be released so that the sperm can find it and it gets fertilized. Then the next thing, as a factor responsible for fertility, we are saying that there should be tubes which are patent, and the oocyte should be picked up by the fimbriated end of the uterine tube. The fallopian tube should be patent, meaning that there should be enough space, there should be nothing constricting the fallopian tube, and the fibril should be able to receive the ovum when it is being released from the ovary so that it can now move to the ampulla. Then we shall also look at another factor responsible for fertility, that the spermatozoa should fertilize oocyte at the ampulla of the uterine tube. Fertilization, as earlier said, takes place in the ampulla. So the sperm, which we say the healthy sperm, should be able to meet the egg, which you are calling oocyte, and fertilization should take place at the ampulla. If that happens, then you are likely to have fertility, and this couple is going to get the children. Another thing that we shall talk about in the factors responsible is that the embryo should reach the uterine cavity after 3 to 4 days of fertilization. As you are seeing on this diagram, that it has to take an interval of 3 to 4 days for fertilization to take place. So this fertilized ovum, which we are now calling the embryo, should be able to move and reach the uterus within those days. Why? If it reaches earlier, we are likely to have it move out, and that one we shall not have implantation happen in the right site. If it reaches late, implantation is likely to take place in the tubes, and we shall get issues with ectopic pregnancy. Then another factor responsible for fertility has almost come to the end, is that the endometrium should be prepared by hormones for implantation, and the corpus luteum should function adequately. The endometrium, which is the inner lining of the uterus, you are saying it should be prepared for the implantation to take place, and the corpus luteum, which is now going to produce more of the hormones to maintain the endometrium should also be functioning adequately. With this, thank you for listening. Let's meet in the next lecture and we talk about the causes of infertility. I hope with this shall be able to meet in the next episode. Follow the YouTube link that I already showed. Then we shall be able to get more lectures. This is Modrik'slectures, a clinical instructor. Thank you for listening.